Did you know that there are actually annuities that have no fees that will provide you a guarantee of no losses, participation in an upward moving market, and regardless of the performance of that market, a guaranteed lifetime income you can never outlive, and they'll double that income during your healthcare crisis? Hi there, friends. This is Colin Richards, and we are continuing in a little three-part series on how to make sure you're prepared for the high costs of healthcare and retirement. And this is a differentiator of Lord & Richards. Just like Lord & Richards is a distribution specialist. What do you mean by that, Colin? Well, it means we don't just hang out during your working years and help you grow a portfolio by sticking you in a model and letting what may happen happen. That's what an accumulation-focused advisor does. They really don't worry about things like protection and downturns and income and healthcare and taxes and estate planning and on and on and on. But when you're ready to retire, all these things come into play. They're critical. Now, what I love is if I can get a little bit of a running start, right? If we can have this conversation before you retire. But if you're already retired, do not despair. Lord & Richards is always helping people who are already retired to maintain that retirement for their lifetime. As someone said to me yesterday, you're saying what you mean is in perpetuity, I will never run out of income. And I said, that is exactly right. And there's more than one way to approach this. In the healthcare region, we're talking about the devastating impact of high chronic illness costs that are not covered by Medicare or your insurance. That's the truth. If you can't perform 2 of 6 activities of daily living, like being able to get around or dress yourself or feed yourself, Medicare is not going to pay for it past 90 days. And then you're on your own. It comes out of your pocket. And here's what happens. If one of a couple gets sick and drains the assets, the well spouse who lives at a lower level or actually a bankrupt level, a fixed income, the last thing we want, just living off Social Security, which is, by the way, going to be less when you lose a spouse. So this is vital, folks. It's vital. Let me give you a real solution to this problem. In my last segment, I mentioned some of you have annuities that are part of your income plan. Don't go around knocking annuities. I know people bash them all the time because they're an easy target because they actually have fees associated with them. Did you know that there are actually annuities that have no fees that will provide you a guarantee of no losses, participation in an upward moving market, and regardless of the performance of that market, a guaranteed lifetime income you can never outlive. And they'll double that income during your healthcare crisis, during your chronic illness years, for up to 5 years usually, either at home or in a nursing home, depending on how the product works. These are simply amazing tools, right, that we have today that folks 20 years ago didn't have. And so ignore the people that are bashing them because these are outstanding tools that should be used in a retirement income plan. But let's set that aside for a moment. Let's say you hate annuities and that's just not your thing and you want to put your portfolio in stocks, bonds, mutual funds, and roll the dice when it comes to withdrawing money during down markets out of a portfolio, which will kill you, by the way. So I really wouldn't do that. But let's say you do that. Is there another solution, Colin, that doesn't have the annuity word in it? Absolutely. There's a more comprehensive solution, and I'm not talking about long-term care, which is very expensive by the time most of us get around to thinking about it, much less paying for it. I'm talking about a hybrid chronic illness solution that sits on the back of a life insurance policy. You say, oh, I hate life insurance too. Well, I think you'll like this one because this is the one that people tell us the most. I've never heard of that. I'm very interested. Please tell me more. And at the end here, we're going to give you our phone number and I want you to call us and we'll tell you all about it. So did you know that you can buy a life insurance policy that just like any other policy will pay your loving spouse or family or whatever good cause a death benefit, tax-free? That's wonderful. You say, but Colin, at this stage of my life, my kids are doing better than I am. I don't care about that. Well, you make sure your spouse is taken care of, right? But it's possible to do that without life insurance. So let's set aside the death benefit for a moment. Let's call it a living benefit. You say, a living benefit? What is a living benefit? Well, did you know I did this for my client, John. He came to me, he said, Colin, I've got, $250,000, $275,000. And I'd like to set this aside because you told me, hey, I might run into chronic illness costs. There's 70% likelihood of needing hundreds of thousands of dollars to cover this on my own. And I didn't tell him to put it into cash. He was thinking about that, but it needs to grow, right? These costs are going up. And I didn't tell him to put it in the market because we don't want to lose the money that we need. I said, John, buy a life insurance policy. He says, why would I do that? I'll already be, dead when we actually need the money while I'm alive. I said, well, here's the cool part, John. Take the death benefit out. Have your spouse take the death benefit out while you're alive, tax-free, and pay your chronic illness costs. You know how that worked out for him? He put in $275,000. It was instantly worth, in his 60s, $922,704. I remember the number very well. And his wife could take $922, not $275 out, if he needed that care. And by the way, that was the approximate estimate of what his care would cost for a 4-year stay by the time he got into those later years where it's likely, such as in your 80s, to need this kind of care. But it was available even before then, from day one. And these work differently and they have different setups, but here's the reality. They can be low cost. They can also have an investment component, or they can just focus in on covering your care. And by the way, if you never need that care, which we hope you're in that lucky 30%, it just pays out that money to your family tax-free. Or if you change your mind, you can get all your original investment out after just a few years, if that's your druthers. So there's no such thing as perfection, but these tools that I'm telling you about are creative and alternative. And I know you're not hearing about them because the people that are coming to hear me speak and the people that are coming into our offices are completely dumbfounded that this exists and their advisors never told them about it. Well, I would love to talk to you about this. I would love to talk to you about the other key areas such as income distribution, tax planning, which is vital, your biggest expense in retirement, estate planning, making sure the government doesn't get all your money, and on and on. These are the things that we do for you to give you peace of mind so that you can retire financially independent without worry. It simply starts with a phone call.